Hello everyone, my name is Dr. Joel Rosen. I am a functional medicine practitioner and today I want to talk to you about fibromyalgia. What I want you to do is pause this video, grab a pen and paper because I'm going to be sharing with you a lot of things that you've never heard before and will give you a head start on what you can do to look at your problem a little bit differently and hopefully get you the answers you're looking for. First of all, I want to let you know that you're not crazy, that you are suffering with a real condition, even though your doctor may think that you're crazy. A lot of doctors do because they simply do all these different tests with you, and then at the end of the day, they don't find anything conclusive. And so they potentially give you antidepressants, or give you Lyrica, or Neurontin, or gabapentin, or maybe an oxycodone or some kind of ibuprofen or muscle relaxer and painkiller, but they typically want you out of the office as soon as you got in there because you're looked at as a difficult patient. And I know you're frustrated, you're sick, you're angry, and you're looking for solutions, and you're probably wondering what's this guy going to tell me that I don't already know? So let's go forward. So first of all, I wanted to let you know that fibromyalgia is a very real problem. You're suffering with multiple pain points across the body, trigger points potentially, but there's a lot more going on than just that, and that's what I want to talk to you today. So what we have you guys do is we have you guys fill out a metabolic assessment form, and I'm going to provide that to you on the link underneath this video so you can follow along a little bit differently. But I have 10 different categories that I want you to pay attention to, and I want you to answer to the best of your ability if you suffer with these problems. The first category is category number 1. And here's the answers. Here's the question to these. Here's the question. I want to let me know if you have a 0 in that it doesn't happen at all. 1, it happens a little bit of the time. 2, it happens most of the time. And 3 is all the time. Okay, so feeling that your bowels do not empty completely. Your lower abdominal pain is relieved by stool or gas. You have diarrhea or you have constipation. You have hard, dry, and small stool. Your coated tongue or fuzzy debris on your tongue. You pass large amounts of foul-smelling gas, more than 3 bowel movements a day, and you use laxative frequently. If you answered 1, 2, or 3 to that question, then I want to let you know that you have a colon problem. So if you have a colon problem, what that basically means is that's where our water is absorbed, that's where our fat-soluble vitamins are absorbed, that's where a lot of our minerals are absorbed, that's where we can have bacteria overgrowth. And so you're not just dealing with a fibro problem at this point, you're dealing with a colon problem, and potentially you need to identify the toxins in your colon or your bowels, and you need to identify them, you need to remove them, and you need to stabilize that. So that's the first thing that hopefully you're thinking a little bit differently that no one's ever told you about. Category number 2, increasing food reactions or frequency, unpredictable food reactions, aches, pains, and swellings throughout the body, frequent bloating and distension upon eating, abdominal intolerance to sugars and starches. I mean, that probably defines you because that's what you're dealing with. Number 2, if you have any with that, what you're going to do is you're going to write down barrier, that's a B, barrier systems. You're dealing with a barrier system problem. What's a barrier system? A barrier system is like the house that protects the inside from the outside. Your body protects the inside from the outside. So your skin, your lungs, your gastrointestinal system, your blood-brain barrier, those are all protecting your inside from the outside. And when those start to break down from inflammation and scrapes and cuts and food sensitivities and infections, then that's going to break down and you're going to have some more reactions that we just mentioned. Category number 3, intolerance to smells, intolerance to jewelry, intolerance to shampoos, lotions, or detergents, multiple smell and chemical sensitivities, and constant skin outbreaks. If you answered 1, 2, or 3 to that, we're going to answer, again, barrier systems. With this barrier system, this happens to be more the brain barrier and the lung and skin barrier. Whereas the other barrier system has to do more with the gastrointestinal barrier. Suffice to say, your barrier systems are breaking down. And there's a lot of tests that we can do. We can do an intestinal permeability test, we can do a food sensitivity test, we can do a gluten test, and we can do immune testing to determine what's going on with you there. Category number 4, excessive belching, burping, bloating, gas immediately following a meal, offensive breath, difficulty with bowel movements, sense of fullness during and after meals, and difficulty digesting fruit, vegetables, and undigested foods are found in your stools. If you have a problem with that one, let's put in here, we have a stomach problem. And I can't tell you how many patients that I consult with that don't realize they have a stomach problem. They're not secreting enough stomach acid. Quite simply, if you're older than the age of 30, you've lost the ability to disinfect your food and squirt stomach acid, so that food just sits there, and then it rots and it ferments, and then you develop inflammation and food sensitivities, and then guess what you do? You take antacids because you think that you have too much stomach acid, when in fact it's too little stomach acid most of the time, and that's creating even more problems. And no one's telling you about this because they're thinking you're crazy, that there's no such thing as fibromyalgia. Category 6. Stomach burning pain or aching 1 to 4 hours after eating, use of antacids, feeling hungry an hour or two after eating, heartburn when laying down or bending forward, temporary relief by using antacids, food, milk, or carbonated beverages, digestive problems subside when you rest and relax, heartburn due to spicy foods and chocolate or citrus, and peppers, alcohol, or caffeine. Again, this is a stomach problem as well. This is too much stomach acid. So one of the questions people ask me is, how can I have too much and too little? And what I answer to them is, it's typically too little and they're mimicking the feelings of too much. And we need to fix that. The next category is category number 6. Roughage and fiber cause constipation, indigestion and fullness that lasts 2 to 4 hours after eating, pain, tenderness, soreness on the left side of the upper rib cage, excessive passage of gas, nausea and vomiting, stool undigested, foul smelling, frequent urination, increased thirst and appetite, difficulty losing weight. If you answered yes to any of those, or 1, 2, and 3, sometimes a lot of the time, or all of the time, then you have a small intestine problem. And the small intestines is where we do most of our absorbing. It's where we have the release of pancreatic enzymes, and we need to break down our carbohydrates and fats in this area. That's necessary for hormone production. So can you see how you don't just have a fibro problem, you have a gastrointestinal problem. Everything that I've talked about right now is gastrointestinal. Let's talk about the next category. Greasy or high-fat foods causes distress, low bowel gas or bloating several hours after eating, bitter metallic taste in your mouth, especially in the morning, yellowish cast to your eyes. Pardon me. You have stool color alternates from clay color to normal brown, reddened skin, especially on the palms, dry flaking skin and or hair, history of gallbladder attacks or stones, or a lot of you have your gallbladder removed. If you answered 1, 2, or 3 to this category, then let's put in there that you have a gallbladder problem. So a lot of people will say, well, I already got my gallbladder removed. And that would tell me that yes, then you do have a gallbladder problem. The gallbladder problem is very, very necessary for secreting bile so that you can detoxify and that you can also absorb your fatty acids like cholesterol to make hormones. So that's a huge problem. The next thing we'll look at here is acne or unhealthy skin, excessive hair loss, overall sense of bloating, bodily swelling and for no reason, hormone imbalances, weight gain, and poor bowel function. If you answered 1, 2, or 3 to these categories, then let's say that you have a liver problem. Liver problem is necessary for a lot of functions, and no one's telling you this because they're looking at your blood work from a laboratory range, not a functional range, and too many things are going on that look like it's normal, even though you still feel crappy. And so we have a liver problem that we need to detoxify. Let's go with category 6 and categories 8 and 9. Actually, these are 9 and 10. Crave sweets during the day, irritable if meals are missed, depend on coffee to keep going, get lightheaded if meals are missed, eating relieves fatigue, you feel shaky, jittery, and lightheaded if you miss a meal, agitated easily or you're upset easily, you have poor memory and forgetfulness or blurred vision. If you answered yes to any of those, then you have a blood sugar problem. Blood sugar is necessary for your cells to get fuel, and if you don't get fuel into your cells, they fatigue, and if you fatigue, you don't regenerate and you have a lot of pain, thus fibromyalgia. How about fatiguing after meals, crave sweets during the day, eating sweets does not relieve sugar cravings, must have sweets after meals, you crash, your weight to girth measurement is getting bigger, frequent urinations, you get thirsty and your appetite is increased, and you have difficulty losing weight. Again, this is a blood sugar problem, typically being too high, and this is a blood sugar being too low. Got a couple more categories. Can't fall asleep, you crave salts, slow starter in the morning, afternoon fatigue, dizziness when standing up quickly, afternoon headaches, headaches with exertion and stress, weak nails. If you answered yes to any of those categories, then realize that you have an adrenal problem, and that's typically too little adrenal glands. You've been stressed out for too long. Does that sound like you? How about cannot fall asleep, perspire easily under high amounts of stress, you weight gain when even though you're under stress, you wake up tired for 6 hours or more of sleep, and you have excessive perspiration. Again, that would be an adrenal problem, but too high. The last categories are thyroid. So if you're tired, sluggish, require excess sleep, you gain weight easily, you have difficulty with bowel movements, you're depressed, or you have lack of motivation, you have morning headaches that wear off as the day goes on, you're losing the outer third of your eye, or you're losing hair, dryness of your skin, mental sluggishness, heart palpitations, increased pulse even at rest, insomnia, night sweats. If you have any of those, then you have a thyroid problem. So what I would tell you is you need to be worked up metabolically, because it's not just a musculoskeletal problem. You have thyroid problems, you're not converting food into energy, you have hormonal problems, adrenal problems, blood sugar problems, gastrointestinal problems, liver problems, and no one is looking at you in this perspective. So what I want to do is just answer some of those questions that are going on in your head about what can I do to help this. First of all, you need to go see a functional medicine doctor that's going to look at you properly and get you to fill out this questionnaire and then get to the bottom of the problem and then basically help your fibromyalgia. So hopefully you found this video informative, and I blew right through it, but you can check out my website on the link below and get more information on fibromyalgia.